here today with David Herrera, Chair of the European Workshop in Periodontology and Chair of the Workshop Committee, and Pål Barkvoll, President of ADE. David, to start with you, what does it mean to EFP and the Perio Workshop to have the presence of ADE and the collaboration in this exercise?
That's a very important question, Peter, because when we decided that it was time to do another workshop on education in periodontology in Europe, as we did in 2009, we thought that we need the help of the best experts in Europe in the field of education. So those experts are in the organization, in our friendly organization, Association for Dental Education in Europe. And for us, their presence in this workshop, as it happens in 2009, is crucial for the success. So I'm very thankful to Pål Barkvoll for accepting to be part of this workshop, and their role, the participants that belongs to ADE and are in the workshop are providing excellent comments and a lot of feedback, very interesting feedback. So it's a crucial role.
EFP has worked significantly in recent years with a number of workshops to develop clinical practice guidelines. Why do you think it's important to now take that forward and integrate it into education in periodontology?
So since 2009, when the first workshop took place, there are many things that has happened in periodontology and in dentistry that makes necessary to update the recommendations for education and periodontology. I can name a few, but you may consider COVID-19 as an example and the associated challenges. So one of that novelties are the publications of the clinical practice guidelines developed by the European Federation of Periodontology. Those guidelines are not only important for the clinicians or the patients, they are very important for the training of the future periodontologists, both at the undergraduate and the postgraduate level. So it is very important to tackle these clinical practice guidelines in this workshop on education in periodontology in 2023.
Okay. And Pål, since the last joint workshop in 2009, in 2017 ADE developed a new undergraduate curriculum framework to harmonize the undergraduate curricula and ultimately, I suppose, to provide better quality of patient care. So again, how do you think this impacts on what we're trying to do here this week?
I do think it's very important, and I really appreciate to be invited here by the EFP. And what I see from ADE's point of view is that this is an organization within the dental disciplines that are working very good with high quality. They are working just like a family, and to see what they are doing. And I'm impressed of the work I've seen here so far, and to see the working groups working with excellent topics and good work. However, for me, I'm not a periodontologist, coming from oral surgery, oral medicine. It's a little bit different because we do not have this within my discipline. However, what I do hope that we from ADE can do in this workshop is also to focus on looking outside the oral cavity and to bring in that we are not having an oral cavity on two legs. We have one patient, and it might be important that we deal with integrating the oral cavity into the rest of the body and follow up what I do think is very, very important for our dental discipline now is to see what's decided by the WHO, where all member states have signed a paper that to integrate oral health care into primary health care. And with my medical background, I do think that's important to see the work you are doing in Perio, but also see how important it is to prevent general diseases. And that's very important from my point of view.
Okay. And so I suppose it naturally then feeds that having experts from both ADE and EFP here together creates some potential to influence the future of periodontal education. How do you see this week contributing to the future of periodontal education in Europe?
Yeah, and of course that's very important, and I see also in general medicine how important it is to look into the oral cavity when they are doing diagnosis in lung diseases, pneumonia, and how important is it to have a good oral health in nursery homes, in hospitals. And your expertise is extremely important, but you have to reach outside the perio environment also to reach other health professionals. And that's what I do think is a challenge for your specialty profession, to reach out, have dialogue with the rest of the health service, because it's so important.
Okay, thank you both for your time today. We look forward to the rest of the meeting.
Thank you very much, Peter.
Thank you.